Hi friends, this is Dr. Chandan Mohanty, and in this video I will be discussing about the topic bioavailability. This is an important topic and which comes in the subject biopharmaceutics and pharmacokinetics, which is taught in B Pharmacy 6th semester and PharmD 4th year. So in this video today I will be telling about the definition of bioavailability, its type. Two types are there: absolute bioavailability and relative bioavailability. Then objectives of bioavailability study. First, definition. Bioavailability can be defined as the rate at which and the extent to which the unchanged drug is absorbed from its dosage form to the systemic circulations and becomes available at the site of action. So here two things are there: the rate at which drug is absorbed and the extent amount to which the drug is absorbed. Both this rate and extent of drug absorption is called as drug bioavailability. So simply we can call it as the rate and extent of absorption of a drug from its dosage form. So how this rate and extent are important? Both this rate and extent of drug absorption are important. First, rate. The rate at which drug is absorbed is very much crucial in case of emergency like asthma and heart attack. In case of emergency, rapid onset of drug action is required. If the drug is not reaching to the site of action rapidly, then patient may suffer, even the patient may die. So in those cases, rapid drug absorption is required. Drugs should be absorbed rapidly. The rate should be high enough. Then only we will achieve our therapeutic effectiveness. Our goal can be achieved. Along with the rate, extent also very important. How much drug is absorbed? In case of chronic conditions like epilepsy and hypertension, how much drug is being absorbed is very important. Suppose we are taking 500 mg of a tablet, out of that only 100 mg is absorbed, then our goal cannot be achieved. The drug should be absorbed sufficiently to the site of action to give its pharmacological action. Then only our therapeutic goal can be achieved. So both this rate and extent of drug absorption is very much important, and this is called as drug bioavailability. So simply we can call it as the rate and extent of absorption of drug. This is bioavailability. Now, the routes of drug administration is also have a major impact on the drug bioavailability. The order is first parenteral, followed by oral, followed by rectal, followed by topical. In case of parenteral route, there will be highest drug bioavailability because the drug is directly given into the systemic circulation. So all the drugs will be available biologically to the blood circulation. Hence it will be highest in parenteral, followed by oral route, followed by rectal route, then last is topical route. Next is bioavailable fraction. It is the ratio of bioavailable dose to the administered dose. This ratio is called as bioavailable fraction. Means how much drug is biologically available to how much dose we are administering. That ratio will be called as bioavailable fraction. After oral administration, this ratio will be varying from 0 to 1. This value will varying from 0 to 1. Lowest value will be 0 and highest value will be 1. When 0, when the bioavailable dose is 0, means no drug is absorbed. When no drug is absorbed, in that case, bioavailable dose will be 0. 0 by something is always 0. But when drug is completely absorbed, when all the drugs are being absorbed, in that case, bioavailable dose will be exactly equal to the administered dose. So after oral administration, this value will range from 0 to 1. 0 when no drug is absorbed, 1 when all the drugs are absorbed. So highest value will be 1 and lowest value will be 0. But after IV administration, this value will be 1. because as we know, in IV administration all the drugs are reaching to the blood circulation, so drug is completely absorbed. So in that case, this bioavailable fraction value F will be 1 because all the drugs are absorbed. Types of bioavailability. There are two types of bioavailability. Number one, absolute bioavailability, and second one is relative bioavailability. What is absolute bioavailability? When the systemic availability of a drug administered orally is determined in comparison to its intravenous administration, then it is called as absolute bioavailability. Means here, after oral route, how much we are getting by availability, that is compared with the intravenous route. When it is compared with intravenous route, it is called as absolute bioavailability, and this can be represented by symbol F, capital F. This F is the ratio of AUC oral into dose IV divided by AUC IV into dose oral. Means after oral route, how much we are getting AUC, area under the curve, into dose IV. After IV route, means what is the dose of IV route divided by how much we are getting AUC after IV route, then into dose of oral route. That ratio will be called as absolute bioavailability. So this can be calculated by this formula: AUC oral into dose IV divided by AUC IV into dose oral. Relative bioavailability. When the systemic availability of a drug after oral administration is compared with that of oral standard of same drug, that means aqueous or non-aqueous solutions or suspension, it is called as relative bioavailability. It is represented by the symbol FR. R stands for relative. So in absolute bioavailability, we are comparing the oral route with intravenous route. But here both are oral route, but one will be standard, one will be test. When the test sample is compared with standard sample, both will be given by the oral route, that is called as relative bioavailability. And this can be estimated by the formula AUC test into dose standard divided by AUC standard into dose test. Means the test samples AUC, area under the curve, multiplied by dose of the standard, our standard sample, divided by AUC of standard sample into dose of test sample. That ratio will be given as relative bioavailability. So in case of absolute bioavailability, we are comparing the oral route with intravenous route. In case of relative bioavailability, we are comparing the test and standard of same oral route. So these are two types of bioavailability: absolute bioavailability denoted by symbol F and relative bioavailability denoted by symbol FR. Objectives of bioavailability studies. First point, to develop a suitable dosage form for a new drug. When a new drug is there, their physicochemical properties is unknown to us. So which dosage form will be best for that particular drug? In that estimation, bioavailability plays an important role. So if you know the bioavailability, so that we can plan for which dosage form will be best suited for that drug. Second point, to study the influence of various factors such as excipients, patient related factors, and possible interactions with other drug on the efficiency of absorption. So if you know the bioavailability of a drug, then we can compare with the other drugs. So whether there is any interaction, whether the patient related factor is affecting the drug absorption, and whether the excipients are having an impact on the drug absorption, that can be known if we will compare the bioavailability of both the formulations. Then next point, to develop a new dosage form or a new formulation for existing drug. So when a drug is already there in the market, And if you want to market your new formulation of the same drug, then you need to prove that your formulation is bioequivalent with the already existing one. So when you will apply to the FDA for new drug application, you need to prove that your formulation is bioequivalent with the already existing one. So in that case, you need to prove that your drug's bioavailability is more or at least equal to the already existing one. Then last point, to be used as quality control parameters of a drug product during the early stages of marketing. So in phase 4 of clinical trial, post marketing surveillance, so this can be act as a quality control parameters. So if the drug's rate and extent of absorption is not sufficient enough, then that formulation can be withdrawn from the market. So these are the objectives of bioavailability study. So in this video we have discussed about the definition of bioavailability, then bioavailable fraction, which is the ratio of bioavailable dose to the administered dose, then two types of bioavailability, absolute bioavailability and relative bioavailability, then last, objectives of bioavailability studies. I hope all of you understood this concept. If any doubts, questions, queries are there, please ask in the comment box, and please subscribe to my video and press the like button. I will come soon with a new video on this bioavailability. Thank you. Bye.